Well, as we said, this is a disease that there was a big lack of systemic interventions for this disease. So these patients usually get to the otolaryngologist or laryngologist. These patients are either pediatric patients who have RRP or adult patients with RRP. I can tell you, having seen many patients with this condition, the toll on the quality of life is significant. First of all, there's airway problems potentially, voice issues potentially, and the problem also is that the more surgical interventions you do, the more challenge or injury you induce or potentially induce to the airway. And so the goal, of course, is to, with introducing effective systemic therapies, is to try to decrease the need for these invasive surgical interventions that would also lead to deterioration, possibly in their quality of life. And so we've used drugs like Bevacizumab, VEGF inhibitor, which works very well for these patients, but it turns out when you stop Bevacizumab, the process returns. In other words, the symptoms return. So Bevacizumab was very encouraging because it was really one of the very first, very effective systemic agents that we could use for this disease. However, we want something that is also lasting. We want something that is preventing the use of continuous medications or continuous procedure for these patients. And I think the immunotherapy aspect, specifically the training the immune system to attack virus-mediated processes, because let's remember, the viruses, HPV 6 and 11, are really at the root cause of this problem. And so when you try to tackle this way, the hope is that this will reduce the need for surgeries, reduce the need for any type of other systemic therapies. And the future will probably investigate combinatorial approaches, potentially with VEGF inhibitors, potentially with other immunotherapy applications.